My doctor dismissed my symptoms for a year yesterday. I found her crying over my MRI results. My obstetrician dismissed my pain for 13 months as normal after childbirth. Yesterday, I caught her sobbing in the hallway outside the exam room holding my MRI results. Now I need to decide whether to tell my 2-year-old daughter goodbye. The pain started 3 months after Emma was born, sharp, twisting cramps that left me doubled over, nothing like normal postpartum recovery. Dr. Winters smiled, that practice smile doctors give when they think you are overreacting. Your body just went through trauma, she'd say during each visit. Some discomfort is expected. Like I was describing a mild headache, not pain so intense I sometimes couldn't lift my baby. But it's getting worse, I'd insist. Month after month, something feels wrong. The response was always the same. Your blood work is normal, you were just experiencing postpartum anxiety. When I requested a referral to a specialist, she suggested therapy instead. When I asked about scans, she said insurance wouldn't cover unnecessary tests. I started bringing my husband to appointments so she'd take me seriously. Nothing changed. Meanwhile, the pain spread to my back. I started losing weight without trying. My sister visiting from California gasped when she saw me. You look like you are disappearing, she whispered while helping me up from the couch. At my 1-year postpartum appointment, Dr. Winters finally agreed to an Ethersum to ease your mind. When that showed nothing, I thought I was going crazy. Maybe it was all in my head. 2 weeks ago, I collapsed while changing Emma's diaper. My husband called an ambulance. The ER doctor ordered an MRI immediately after examining me, Perte, something my OB had refused to do for over a year. Yesterday, I returned to Dr. Winters' office for the results. The receptionist led me to a room saying the doctor would be right in. 10 minutes passed. I needed to use the restroom. That's when I saw her through the partially open door of a supply closet. Dr. Winters, always composed and dismissive, was crying. Parrot, actually crying parrot, while staring at what I recognized as my file. Doctor? My voice was barely audible. She startled, quickly wiping her eyes. Sarah, I am sorry, I was just reviewing your results. But I knew in that moment before she said a word, I knew stage 5 ovarian cancer, metastasized to my liver and lymph nodes, likely present since before I even got pregnant with Emma. If we had caught this earlier, she started, then stopped herself. A year of dismissal. A year of it's normal and try yoga, and it's just anxiety. A year where it was spreading, growing, claiming territory inside me while I begged someone tainty and painted to listen. I didn't scream, I didn't break down. I simply asked, how long? With aggressive treatment, maybe a year without? She couldn't finish. A year Emma would be 3, would she even remember me last night? I sat in Emma's room watching her sleep, memorizing the curve of her cheek, the way her eyelashes fan against her skin. My husband found me there at 3 a.m., still watching, still memorizing. What do you need? He asked, kneeling beside me. A new doctor, I whispered, and every second I can get with her. This morning I filed a complaint with the medical board, not because it will change my prognosis, but because the next woman who says something feels wrong deserves to be heard the first time. Tonight, I am starting a journal for Emma Parrott, all the things I want to tell her when she's older, all the things I won't be here to say.